When considering looking at anxiety disorders, I always feel it's best to divide them into three main groups. One group is the so-called generalized anxiety disorder, where the patient is anxious about everything and anything. And the second group is so-called specific anxiety disorders. So anxiety that manifests in situations. We call them phobias. For example, anxiety of flying, anxiety of water, anxiety of height, anxiety of spider, or phobia of spider, or phobia of flying, and phobia of anything. And then the third group is anxiety, where anxiety is the underlying symptom, but give rise to more complex, more specific symptoms. For example, OCD is primarily based on anxiety. PTSD, so-called post-traumatic stress disorder, is an anxiety disorder primarily. And anxiety is also common in conditions like addiction, including gambling. And therefore, this third group of conditions are conditions which have been given a different category, but actually the anxiety is what leads that condition. So we have these three groups of these three groups of anxiety disorders, and in this group you can fit almost every anxiety disorder, and that patients will suffer. So I do not want to. The list is quite long, but I think a common example of a specific anxiety disorder is social phobia or social anxiety, which is very common among teenagers and early adults, and also can pop up in later life. And then generalized anxiety disorder is common among the people of say from 50, 60 years and older. And then anxiety of the third group of anxiety disorders, which I mentioned. OCD is one good example, and post-traumatic stress disorder, which is a response to trauma. So these are examples of anxiety disorders. Anxiety disorder can be mild, so mild that it may not be diagnosed. You might miss it. The patient might miss it. Doctors might miss it, and so mild that it may not interfere so much with life. But it can also be very severe. It can be debilitating. It can be it can impact on your social functioning, your finances, your relationship. It can affect your physical health and as well as your mental health. And it can be debilitating. It can be chronic. It can put you out of work for several years. And so there really is no limit to the severity of anxiety disorders. One thing that is important is that for anxiety to be diagnosed as a disorder, it must impact on your well-being, and because just being anxious itself, it may not be an illness, but it must impact on your well-being. Again, it goes back to the impact of anxiety on your well-being, because we recognize anxiety as a natural emotion, and therefore just feeling anxious itself may be a normal psychological response to situations and events. But when that response is followed by other symptoms, and when that response leads to you not being able to enjoy life, not being able to perform your social functions, and not being able to have good quality of life, then that anxiety becomes a disorder, and you should seek help for your anxiety. But by that time, we often find that there are other symptoms that accompany the anxiety, and not just feeling anxiety alone. And people should seek help when they find that there are any aspects of their well-being is affected by the anxiety. One common thing that people do when they have anxiety disorder is to try and self-medicate. Now, self-medicating is rewarding in the short term. So, for example, you're feeling anxious, and you take you take alcohol, you take some tablets, some calming tablets, and it helps you. But what that does is that it tells your mind that if only you take these tablets, a bit more of it, you'll feel even better. And the more you self-medicate with those sedatives or alcohol or drugs, the more your mind becomes wired to depending on them for to relieve your anxiety. And therefore, and then from suffering from anxiety, you then go on to develop other potentially more serious addictions, and in addition to the impacts of these substances on your physical health. Therefore, the general advice is that people should not try to self-medicate with anxiety, self-medicate the anxiety symptoms, but seek professional help. As with every condition, a very good history is important. We have to listen to the patient's symptoms, especially as they suffer it, as they present it, not how we think they should present. And by listening to the patients and to their symptoms, we are able to identify the symptoms of anxiety. And these symptoms can be they come in different forms. They may be physical, they may be psychological, they may be cognitive in terms of our thoughts. But if we listen to them and we can look at, you can find a pattern of when these symptoms started, how they link with the interact among themselves, and also the person's own experience or suffering. That helps us to diagnose anxiety. It may also help us to differentiate anxiety from other conditions. Again, by listening to the person's own story, we are able to decide whether these symptoms are caused by anxiety or whether there could be other explanations for these symptoms. And so, as with any other mental disorder, history and listening to the patient is very important.